good afternoon to anyone in the future who is like or who is like going to listen to this Google podcast I'm doing with Nouhaila.
Yep.
So today we are going to discover the biomedical sciences. I guess there is more than one science. And yeah, I prepared some different questions, some specific questions that can like help. Can you or would you love to present yourself for anyone?
Sure. So I'm Nouhaila. I'm in my final master's degree year. The program that I am currently studying is Applied Biomedical Sciences in the International University of Rabat. And I'm currently very close to graduating. My thesis defense will be July 24th. So it's like I'm very soon to the closure of this program. What else? Yeah, I obtained a bachelor's degree in genomics, an excellence bachelor's degree in genomics in the University of Mohammed V in the Faculty of Sciences in Rabat. So yeah, basically I've started with my academic journey with genomics, and people who know genomics would know that there are broad things to do when you know genomics and when you have a degree in genomics. So you could then work with plants, bacteria, and humans. I chose the human side, so I chose the biomedical sciences because they're more interested in the human side of the scientific fields, and having a bachelor's in genomics helped me a lot in this master's program. So yeah, that's it.
It's very interesting to know that you are going to finally start a new journey in your life, in your professional life after being a student. That's very nice. And if I'm going like to reformulate what you just mentioned, so you are like studying biomedical sciences as a master degree in the International University in Rabat, and you have a background with genomics, like your bachelor,
Mhm.
etc., and you choose it to understand the health and the body of humans because there you are inspired and you wanna fix issues.
Yep, exactly,
Yeah,
exactly.
so that's inspiring, and it's inspiring because it will help us more to understand what to do biomedical scientists do.
Sure, very, very good question. Well, first, before understanding what biomedical scientists do, we should understand what biomedical sciences are in the first place, because many people mistake them for biomedical engineering, and those are two different uh, degrees and two different diplomas and two different programs, training, whatever, name it whatever you want, but they're really different because biomedical engineering focuses on devices and it is an engineering degree. It's not an it's not a research degree. Well, you can integrate research with it, but its focus is more on the engineering parts, on the devices parts, on the technological part of machines and stuff. So it's very passionate. It's very interesting, and many people actually love it. And when I searched about my medical engineering, I found out that it's a very, very demanded degree or field, and we do need them in all countries because they have great contribution. Now, biomedical sciences are quite different. It's not an engineering degree. We don't do engineering. We don't study the devices. Most of the time, biomedical sciences is focused on research. Basically, it focuses on a broad fields. It combines many sub fields, if I may call them, like human biology, health, disease, molecular biology, AI in healthcare. Believe it or not, we do study AI, AI in human in healthcare. There's also chemistry, physiology, genetics, pharmacology, and really a broad range of sub sciences. So it's a very interesting one because it doesn't focus on only one thing, one part of the spectrum, but it's really a broad combination between many interesting subfields. It focuses on human anatomy and physiology, molecular biology and genetics. And just for the ones that need a little bit of elaboration on physiology, I think anatomy, everybody knows it. It's the study of the organs and so on. Physiology is basically the function and the organs and the tissues and the whole system. So it's an investigation of the physiological processes that happen in the body rather than the organs themselves, but really what the organs do, the physiological processes, and how it gets disrupted in various diseases. Another thing is molecular biology and genetics. And that's basically the exploration of molecular mechanisms that regulates our biological processes by which we live, and how our DNA, how our genetic material factors contribute to our health and disease. Believe it or not, the basics, or let's say the primarily what decides most of what happens in your body is your DNA. So its study is fundamental, and it's like studying the root of many problems. I'm not saying that all problems are due to genetics. There are a lot of diseases that aren't related to genetics. There is a broad spectrum of them that are related to DNA. But basically, even your hair color is coded in your DNA. So the color you have in your hair or your eyes or your skin is decoded in your DNA. So yeah, this part studies the cellular processes to understand the genetic disorders and identify their disease markers, and ultimately for the aim to develop targeted therapies. Biomedical sciences also focus on microbiology and immunology because very important parts of human health is the immunological system, right? And so when we're talking about immunology, we're also talking about focusing the discovery, the development, and the evaluation of the body's interaction with microorganisms. So they focus on pharmaceutical drugs and on their implementation, how these drugs interact with their biological targets, and how we can assess their efficiency, efficacy, their safety, and so on. So this part contributes to the development of new therapies. Another thing that the field of biomedical holds interest in is pharmacology and drug development. This is a very beautiful one. I personally love biotechnological drug development, and we had it as a really big module, this one. This focuses on pharmaceutical drugs. Sorry, when I said the immunology, it's not pharmaceutical drugs. The immunology is we're interested in investigation, like I said, the interaction of microorganisms such as bacteria, viruses, and parasites, and their interaction with the human immune system. And so it's the study basically of infectious diseases, and it helps us develop vaccines and, of course, explore our immune system, our immune responses. Now, coming to the one that I really love, which is drug development. It is this one is the one that focuses on the discovery, the development, and evaluation of pharmaceutical drugs since the beginning to the end and commercialization of drugs. This part studies how drugs interact with the biological targets, and in this part that we have clinical trials that focus on efficacy, efficiency, and safety. So it's not in the immunology part, sorry. Um, and this part of drug development contribute to the development basically of new therapies. So this is a really it's a part that influences a lot the pharmaceutical industry. In biomedical sciences, sometimes some include biomedical engineering, some just like modules, like a module, but it's really a whole different degree. And medical devices. So basically, biomedical sciences or biomedical scientists have to have a knowledge, at least a basic knowledge on the development or how medical devices work and technologies work. So they collaborate with engineers, with biomedical engineers, biomedical sciences and biomedical engineers to develop the technologies, the devices, to innovate many systems that are used by healthcare professionals, just like imaging systems, diagnostic tools, what else? Wearable devices in order to enhance healthcare diagnosis, monitoring and treatment, as well as keeping up with the patient. Um, and the final thing that I'm going to mention, well, there are a lot more, but just to not to over explain. There is clinical research and translational medicine and epidemiology in public health. Now, clinical research translational medicine is basically the contribution to clinical research studies. And we talk about clinical trials, preclinical trials, and it's all primarily clinical trials to evaluate the safety and efficacy of the treatments, of their therapies, and it's really like a building a bridge to fill the gap between laboratory research and clinical applications that are done by healthcare professionals, and it facilitates the translation of scientific discoveries into real world practical healthcare. Epidemiology and public health, this is a very, very beautiful part also of biomedical sciences. So this part focuses on investigating patterns and causes of disease in populations. Just like what the World Health Organization does. And also they conduct epidemiological studies, they analyze health data, contribute to public health initiatives. All of this in the aim of disease prevention and making really appropriate policies. So it helps policymakers. It helps decision makers. It helps decision makers into protecting the overall health of populations. So those are the subfields of biomedical sciences. Human anatomy, physiology, molecular biology, genetics and genomics, microbiology, immunology, pharmacology, drug development, biomedical devices, clinical research, translational medicine, epidemiology, and public health. There are other things, but just let's keep it. It's already enough, I guess. So coming really quickly to answer you now, since we understand what are biomedical sciences. So biomedical scientists basically do everything that I just mentioned. They contribute in every single subfield. So when we're talking about research and experimentation, they're the ones who are in clinical trials, doing the whole research. They conduct the studies to investigate various aspects of human biology, of the disease, as well as, of course, medical treatments. Their role, obviously, they can design experiments, they collect data, they analyze the results, and of course, they draw conclusions because that's the aim, basically, in the end. So they study a lot. They study a lot of mechanisms. They explore a lot, and they investigate a lot to finally develop new innovations. They can work in laboratory testing and analysis. So people who are very passionate about lab work and with the wet work as we call it, they do work in laboratories, performing tests and analysis on patient samples and experimental specimens. They use specialized equipment, the equipments and techniques, provided by biomedical engineers, and also all technologies to examine a good number of molecules like proteins, DNA, RNA, the cells, and also the tissues and other biomedical material. So these tests, as you all know, they help us in diagnosing, monitoring, and studying and refining the treatment. The third thing they do is they do the interpretation of data and reporting, because they have to interpret the results of the laboratory tests and experiments. They need to analyze the data to finally come up with conclusions, or at least, because that's the aim in the first place of collecting data or doing tests. Another thing they do is to collaborate and communicate. This part, it's really about collaboration with other researchers, healthcare professionals, and interdisciplinary teams. So they participate in conferences, and conferences are the part in which everybody who's working, who's interested in the health field, and the health field would go. So you have a conference where every single person who's interested in the health field would be there, and biomedical scientists or scientists in general would present their research findings, and they would engage in scientific discussions, so that healthcare professionals like doctors, nurses, surgeons, policymakers, many people to engage in these discussions, to get updated to what do we have right now, and to keep up with the fast growing field. So it includes communication and exchanging of information. The last thing that I'm going to mention is a very, very important part, which is they do take the quality control and assurance part, because in our field we have to adhere to strict quality control and quality assurance protocols. There's no room to gamble. I mean, it's people's health that we're talking about. And so in order to really keep things safe, we need to follow some quality and some control protocols. And many biomedical scientists could become inspectors, quality control inspectors. They could work in auditing other labs or other manufacturers and everything. So they have to follow standardized procedures. The ones that are working in the lab, they have to maintain the equipment in good state and monitor, obviously, the accuracy and especially the precision of their tests and their accuracy, because it's a very it's really a responsibility that's not very easy.
Yes.
So yeah, they perform a lot of other things, but those are the ones that are related to research, wet lab work. um, scientific communication. But for the people who are interested in entrepreneurship, because you have this slide that mentioned biotechnology and entrepreneurship, well, don't worry. There is a big part of business share that biomedical scientists could get into. For instance, they work in the pharmaceutical industry. They work in pharmaceutical businesses, and in their regulatory affairs, in their communications, clinical trials. Like I said, they can be project managers. This is one of the best things biomedical scientists could do, is project managing. When you have a scientific project, or a health related project, the skilled biomedical scientists that have been in the field, and that they have project management skills, would step forward, and they would acquire the skills, they would acquire the experience, and they have a lot of transferable skills. Because when you're a biomedical scientist, you develop analytical thinking and problem solving capacities. You're able to interpret data. You do pay attention to detail. Those are all very important transferable skills
Exactly.
as a project manager. And of course, they do the networking and mentoring, and they bridge the gap basically between the industry and the business and the science. And the last one that I'm going to talk about, which is one of my favorite things that biomedical scientists do, is product management. They could be product managers, and develop the medical project, or the products they're working on. And they could also be pharmaceutical marketing specialists. You'll be like, okay, what it has to do with biomedical scientists? Well, yes, many of pharmaceutical marketing specialists have degrees in biomedical sciences, and combined with marketing training or other, diplomas, they would make great marketing agents and specialists in the domain. So you can regroup business and management administration with the scientific field too.
Yes, 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 yes. That's aspiring. Thank you.
You're
Yeah,
welcome.
and if I'm going again to the like a brief, or to reformulate what you mentioned, and you mentioned a lot of things. Firstly,
Yes.
there is a difference between biomedical sciences and bioengineering. The first one, in engineering, we are thinking devices, we are thinking tech, we are thinking like to find solutions using technology. But in biomedical sciences, we are doing research, and we are in the lab trying, doing experiences, and finding
Yeah.
solutions. And also, you mentioned that there is not just biomedical science, but there is sub-sciences. We are talking about human biology, disease, AI in the healthcare, chemistry, etc. So there is a lot of bio of sciences that help in understanding more the human body, and the risks. And also, when you talked about research, you talked about some technical, I guess, words. I should do like research to understand them more. It's like drug development, and also the development of therapies. And
Mm-hmm.
also, you mentioned like the relationship between what a biomedical scientist do and public health, the practical way to ensure health. And it's nice to know that, it's nice to understand that. And this is the biomedical science. But what they do, as you mentioned, they are working as researcher. So they are like following the methodology of scientific research, like in the lab, in the university. And the most important thing you mentioned at the end, it's like we're not just like working to understand the human body, but we are like doing some quality and insurance to ensure that the product solution is aligned with with the human bodies. That's it.
Yep.
Thank you. So, and if I know all this, second question I will ask is what are the skills so people can become biomedical scientists?
Yes. Well, it really depends on what part of biomedical sciences you want to choose. Because, like I said, there isn't just the research part or the lab part or the clinical or the academic part. There is also the business side, the entrepreneurship. And by the way, many people that I know that have acquired a master's degree or bachelor's degree in biomedical sciences have opened their own projects. They have became leaders. They have became CEOs of their own business because it's a very fast growing field. So you can have your own business or you can work in another company. Like I said, the skills really depends on what you choose. Whether you choose the research and lab clinical trials or academia, or you choose the industry and R&D and industry, of course, or you choose office work, meetings, what else? Project management, like I said, working with designers on the pharmaceutical marketing, and working with people from broad ranges of fields that you're not very familiar with, because when you're a biomedical scientist and you're working with a team of designers, of people with an MBA, people I don't know, coming from engineering. It's very interesting because you develop, and you have to develop before that, transferable skills. So I wanted to say something, but anyways, let me just tell you the skills really in a quick way. Depending on what you choose, the path that you're going to choose, there are some skills you need to acquire. For instance, but really, the skills that I'm going to mention, they should be present, or they should the people that want to work in the biomedical field need to develop, whether they want to work in research, academia, clinics, business, industry, whatever. The first one is that I emphasize on is the excellent communication skills. And I think this is very needed in all fields, but it's really a very important one, because most of the problems inside research teams come from communication, miscommunication. So excellent communication skills are crucial, whether you're in a company, whether you're in an office or a lab or an incubator, whatever. Another skill is the emotional resilience and intelligence, because the field is competitive and it's fast growing, like I said, and there are many things you need to keep up. There are a lot of things you need to do. And yeah, I remembered what I wanted to say is that biomedical scientists could also be counselors, could also be scientific counselors, aka they could help companies that are preparing a project to have to acquire financial aid and to acquire sponsorship. So they evaluate their projects, and they hold meetings with them. They evaluate the customer, and they try to find whether or not they can secure sponsorship for them or not. So this is another thing you can be a consultant to. I'll go back to the skills. I mentioned excellent communication, emotional resilience, emotional intelligence. A little by little, you also develop a calm temperament and the ability to work well under pressure, because this is very important. Another must-have skill is teamwork. Teamwork, because in every single part of biomedical field, you're never going to work alone, even if you're in a lab and you think, okay, I'm just going to do my tests, peace, I'm going to enter to the lab, do whatever I have to do, and then go out. No, it doesn't work like that. A lab is a whole structure, and there are a lot of people there. You need to have great teamwork skills. You need to have the capacity to lead multidisciplinary teams. I guess the teamwork skills are already obvious. Their need is already obvious when you're working in industry or you're working in a company. Uh, and by the way, when you're working in the industry, doesn't mean you're only going to take the office work. You can be with the R&D team. There are a lot of teams. There are really a lot of teams inside the pharmaceutical industry. I really cannot just mention them all, but just know there are a lot of things that one can do. So teamwork is very important, whether you're going to work in a lab, whether you're going to work in academia, research, clinical trials, the business, marketing, everything. Teamwork is essential. Another very, very important one is problem solving. Problem solving is a crucial one because when you're in a very difficult situation, you need to come up with solutions. And the whole field is basically trying to find solutions for every single problem, whether it was a simple one, just like I don't know, our warehouse. There's a problem, and in our products warehouse, and we need to do something. There is this. So the problem solving skills would help you a lot. Needless to say that they will help you also in all parts. Um, and the organization ability and organization skills are very needed. Effective decision making skills, especially for the ones that aspire to become leaders or CEOs or project managers, product managers, marketing specialists. So the decision making skills are crucial, and I'm very sure that people will develop them little by little. But my advice is to try to acquire them while you are a student, via clubs, being in university clubs, or getting into associations or organizations. It will help you a lot. Extracurricular activities. All the extracurricular activities will help you develop these skills. Well, and a very important one is to know how to manage your time and resource and your priorities. That's come on. I think that one is crucial in every single field, especially competitive ones, and especially um, fast growing ones. Yeah, that's it.
Yeah, thank you again. So if I am going to become a biomedical scientist, I should understand firstly that there is more than one path. I can go to a lab, academia, as you mentioned, or business. However, there is some skills that we can like agree about them. And you mentioned excellent communication skills, emotional resilience and adaptability, or intelligence, emotional intelligence, work
Mm-hmm.
under pressure, teamwork intelligence, problem solving, organization skills, and finally you mentioned time management and priorities. And yeah, and I can see that even in my profession, I can say that I need all these skills if I want to become a learning and development professional. And I can see why, because we are talking about humans, and when we talk about humans, even if we are like in the field of science or literature or business or marketing, we need to communicate to do something. So that's why I guess we need to have empathy, to have this intelligence to communicate with people around us in the team, to understand the organization, and when it's like hard work, we need to have this quality of work under pressure, etc. So yeah, I agree with you, and I can see why it's easy and it's difficult in the same time.
Yep.
Thank you. So basically, how can young students guide themselves towards a career in biomedical sciences, and what are the benefits of choosing this profession in your opinion?
Okay, so those are two questions actually. I'm going to answer the first one. Guidance. Guidance is a come on. This is a very very important one, um, and especially in Morocco.
Yes.
We all know the feeling of graduating high school, and not knowing exactly what you want to do. Everybody is talking the very well-known branches or fields. Being a doctor, a nurse, an engineer. I don't know, a teacher, professor. A lawyer. Those are all known, but these disciplines aren't very well known, although we need them a lot, not only in our country but internationally. You cannot imagine the need of the world for such things. So what they can do towards a career in biomedical sciences, this is me trying to help in the guidance. I'm doing this basically to explain to people who are interested about a few things, and they're wondering, well, what can I do? So this is a type of guidance that I'm giving. So please watch the podcast and share it as much as you can. Other people might need it. But another thing they could do to guide themselves is they need to explore what it means. They need to explore further what biomedical sciences means, either by searching in search engines. We all do know that. Asking professionals, YouTube. There are a lot of health professionals on YouTube. They're doing, they describe what they do, etc. Try to target every single gathering, every single scientific gathering. Try to socialize and network with people, because we need networking. Why do we need networking? It provides us with the information we need. Many people, the problem of many students is that they don't know the information. It's not that they don't know what to do, they don't know the information. What is it out there? There are a lot of things out there that they can do and that goes very well with their passions, but they don't know. So seeking information is the best thing that you can guide yourself into biomedical sciences. Whenever there is that you hear about a conference, a scientific conference, go ahead, go there, make some networking, talk to people. That's the first one. Another one is to seek mentorship. Mentorship, of course, comes with knowing your professors, your teachers. If you are studying if you are a high schooler, many teachers aren't aware of these fields. All right, so you might want to seek mentorship when you go to scientific exhibitions, when you go to conferences, when you go to gatherings like those. And of course, a higher education. You need to pursue a higher education in the field. I don't know if there's a bachelor's degree in biomedical sciences, to be honest. But what I know is there is a master's degree. For whoever is interested, it's in the International University of Rabat. It's a very, very good program. High quality professors, sorry, professors, very high quality professors. They do provide the mentorship. They're really great. So yeah, and the thing is, pursue higher education. You need to get a little bit, of course, of experience. For instance, if you get the opportunity to get into a lab when you're still a student, whether you're a high schooler or in your bachelor's degree year, yours, you can explore how it is like. You can explore whether you want to work in a lab or not. So the best thing to do this is to gain experience through internships. If there is the little least chance to get an internship, whether it was in the industry, in a lab, whatever facility, it's very good to have one. It's very good to do the experience to orient yourself, because you might do the internship and figure out that it's not this what you want, so you won't take the path. Or at least you may, for instance, take an internship in lab work and then be like, oh, this is not for me, I would like to try industry, and I would search for internships. By the way, there aren't just face-to-face internships. There are online ones. There are online training. There is online training. There are online seminars that you can help with yourself with. There are practical trainings that are online from the famous the famous companies in the field. So yeah, you just gotta explore, experience, attend conferences, attend seminars, join professional organizations. Every single the organizations that work on the field, even if they're international, they're not here. At least you can build people to guide you through online means. I mean, everybody now has Instagram, everybody has LinkedIn, or if you don't have one, you should have one. Everybody has emails. Everybody has WhatsApp. So yeah, there are a lot of opportunities to gain experience in order to be guided to this. Because unfortunately, when you are a high schooler, the professor that comes, the teacher that comes to orient you, they don't know everything there is. Some of them do the job amazingly, and other ones, they're not very updated to what is it out there. All right, so your job as a high schooler or as an undergraduate is to do the research, search. If you don't know the name of a field, you can Google or you can search a skill. For instance, if you like marketing, but at the same time you're passionate about technology, all right, you do the research and you ask what are jobs that combine marketing and technology, and you're going to get a whole list. And do the research, join seminars, join trainings, online training, conferences, seek mentorship, ask people on LinkedIn, ask graduate students. Just do the research. That's the way you can guide yourself.
Yes, 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 yes. That's clear. I noted. I noted first thing that when we talk about guiding, we should guide ourselves firstly, and that's why I am happy, because what you are doing now, it's a beautiful type of guidance. And also the motivation to explore. You mentioned to explore what I wanna become, what I wanna learn. If I'm not going to explore, so I will never learn. To ask professionals and to watch, like in YouTube, to participate in seminars, etc. And also you mentioned networking and seeking information. Networking is so important, and also seeking the online, like trainings, mentorships, etc. So to learn more. And also if I have the opportunity to visit at least a lab, I will not say no, because I'm going to learn. So to guide yourself, you should accept that you should learn. And if you want to learn, you should accept that you should explore. And if you want to
Yeah,
explore,
true.
you should accept that you don't know. And this is, yeah,
Yeah,
this is very interesting. And
yeah,
why? And why choosing this
yeah.
profession in your
The,
opinion?
yeah, the benefits of choosing, right? The benefits
Yeah.
of choosing the profession. Well, depends on what you like. Let me just talk about the broadest people thing, the broadest reasons why do we work. First of all, many people choose work according to what they're passionate about. Many people choose the work, they like broad ranges of skills, and they think, well, I'm very good at this skill and I don't care about what the job is. I'm just interested in the skill, so I could become a manager and I don't care what field. All right. There is this, and there are people who choose the profession based on how much they're going to get paid, and there are others who choose the field they're going to be in based on the possibilities or the opportunities of growth, growth opportunities. And there are people who just, stick to something just because they think they have no other choice. They think. But in my opinion, there's always choice. You just gotta seek it out. Let's just agree on this. All right. So, why choose the profession? I'm going to talk about all of those. If you're passionate about science, if you're passionate about biology, if you're passionate about healthcare, if you want to have an influence and advance in healthcare, if you really want to leave your mark, that's a great role to play. It's a great profession to have. If you want to have an impact, go for it. If you want to have something with growth opportunities, it's also a possibility to do. For instance, I am a person who is passionate about many fields. All right. I love arts. I love design. I love AI. I do love physics. I love biology, and I love business and economics. So for me, it was very, very, very hard to choose what to do. But really, little by little, the path in front of me was getting, refined, and I discovered that there are a lot of options in this field. There are diverse career options that you could take. So if you want to keep your options open, biomedical sciences are a pretty good choice. Of course, if you're interested in the field, all right, there are other fields that have diverse career options. Okay, I know, I'm very well aware. But if you are very interested in science, but you don't care about research, just want to have, or maybe you don't know, you're like, okay, I love biology, I'm not pretty sure what to do, this or that or that. Biomedical sciences career would be very helpful because it keeps diverse options and options open. If you love collaboration and interdisciplinary work, because my biomedical professionals usually collaborate with experts from different disciplines. For instance, computer scientists, clinicians, engineers, policymakers, businessmen, businesswomen, entrepreneurs. You get a broad range of people you would meet with. But like I said, there are a lot of other professions that would give you the opportunity to have this collaboration. And I emphasize on it. If you like biology, all right, especially biology related to the human, and at the same time you want to go for a collaboration, interdisciplinary work, go for biomedical sciences. If you love competitive salaries and job stability, biomedical careers also offer that, because believe it or not, senior biomedical scientists are very, very, very high paid. They're really very appreciated around the world. They get pretty high salaries. Of course, not as soon as you're going to graduate. Let's just agree on that. The salary you're dreaming of, the big salary you're dreaming of, it's not going to come just right after your graduation. Well, it might, but if I'm not going to say impossible. Nothing is impossible, but usually that's not how it happens. But when you gain experience, there are options, and there are financial opportunities, especially fast growing, the fast growing salary range is in the industry, is in the business, and is in the pharmaceutical business. If you're interested in biology, but at the same time you like collaborations, and you wanna grow fast, you wanna really grow fast, and you wanna get promoted fast and everything. The business side of it will certainly be good one. But research, on the other hand, I don't have much information. But as far as some researchers that I've met, my professors who've been into academia and research, they said it's as a youngster, it's going to be longer. It's going to take you longer to get to the high salary you want. But if you're passionate about it, doesn't mean you're going to be poor. Just to keep things clear, you're not going to be poor. Yeah,
Yes.
but you're just not going to be very rich soon. Okay, so this is one of the things I want to tackle, because um, because we're realistic, all right,
Yes. Yes.
and pragmatic and practical. All right. So yes, it will provide you with the job stability. And for some people, biomedical field provides them with personal fulfillment. I mean, I've seen people who get satisfied of making small. I'm not going to say small, but like contributions. There are a lot of people who love this feeling of accomplishing something in the biomedical field or in the research field, whether be it something very, very simple, but they because they're passionate about it, they like it. All right. So if you're someone like that, I encourage you to go for it. Like I said, seek very well, do your research, experiment, because you might like all of these, but you might not like the biomedical. All right. And you might like the biomedical and find all of this. So I emphasize on it. Do your research very well and experiment. Not all people are the same. Um, like I said, there is the median pay. The median pay, according to I think there is a governmental website. There is a U.S. governmental website in which they have done their report, and they have made a median pay for medical scientists or biomedical scientists in 2021. The median pay would be 95,000 per year. That's the median. And so that's a good one. That's a good one. And it's one that you could start working right after you graduate. You're going to find opportunities, especially abroad. Especially abroad, you can find entry level opportunities. Also in Morocco, you just gotta do the networking. You just gotta search. That's it. Um, uh, what else? Oh yeah, it is a very fast growing field because, all right, let's be practical. You're gonna tell me, okay, all of this is beautiful, is good, but is it going to be demanded from here 10 years, 15 years? Yes. because according to this website, the official USA governmental website for professions, it is growing at 17% rate each year. So it's much faster than average, the average of other jobs that are growing. There is very growing need for biomedical scientists, and they are very demanded, especially with the current challenges we've been facing. For instance, when the pandemic ravaged the world, we it opened our eyes on many challenges we still have. So the demand is very, very high. And come on, healthcare is always going to be in demand, because what do we have more precious than our health? Nothing, I guess. Nothing.
Yes.
Nothing more precious than one's health. So it's always going to be growing. It's always going to be demanded, as long as you keep updating your information and your skills. And that's just, that's just in general. So yeah, those are a few things.
Yeah.
I don't know if I forgot something. If you have any question about another reason to choose it, go ahead,
Well,
because that's everything that comes to my mind.
yes, thank you, because you are you are telling what's on your mind about this. But you mentioned, I guess, everything, because what you see or what you try to explain about choosing this profession starts with motivation, because everyone has a need and a motivation to do something. So we need to do a little bit of experiences to ensure or to discover that this profession is for us, or should we change the direction. And also you talked about the fact that this profession is when you do or when you work in this profession, you will have a good networking, because you are going to collaborate with different people from different fields, in the public health, with business, man and woman, etc., etc. So because it's health, that's why, because it's health,
Yeah.
everyone is interested. Not just I mean, if you are not going to choose to study biomedical sciences, there are people will choose it because it's a necessity in our life. It's something
Yeah.
more than a choice. It's not just a profession, but for me, it's a must profession,
Mm.
if I can
Yeah.
say. So, and you started a little bit talking about the future, but don't worry, we already have the question. What is the projected future for biomedical sciences in the upcoming years?
Okay, that's a very good one. Let me just so add something in relation with your question, your fourth question. Since we're Moroccans and we're talking about Morocco, we're talking about Moroccan students. You're going to say, okay, so you talked about the international level a lot. You gave us numbers from the U.S. It's true, yes. And to be fairly real with you, in Morocco, we don't know this, but I've asked people in the industry and working in Casablanca, and as you know, we do have factories in Casablanca. So I sat with an responsible there, and I asked him. I was like, "Do we need this in Morocco? Like, is this a good diploma or not? Because I need to know." He was like, "Hell yeah, definitely. We do need people with such diplomas in the industry, and there is a growing need for them. We have national companies and firms, and we do have international firms in Morocco in the pharmaceutical field. It's not as fast growing right now. The moment that we speak, it's not as fast growing as it is abroad, but there is development, there is growth in Morocco for the ones of you who are interested in staying in Morocco and they don't want to go anywhere. Although I do have an advice go gain some experience and then go back to develop your country, to really contribute in the development of your country, because Morocco is a great country and it needs us, it needs its youth. So it's not bad to go abroad for a bit of experience, or even stay here, whatever you want, and contribute in the development of this field in Morocco. I guess this is not based on any statistics, but just my personal guess. I guess it will keep on growing even in Morocco, and there is a growing need. So we will find opportunities in the pharmaceuticals. You just need to believe. All right. The thing is, the advice that I'm going to give to every single buddy: don't listen to people who tell you there are no jobs in Morocco, or that it's all about do you know this or do you know this person. I'm okay. I'm very honest. I'm a straightforward person, and I'm going to talk about this because we're talking about something that's going to be in real life. It's a very important decision. All right, don't listen to others who are trying to tell you it's not going to work. You know, there is this part that research or academia is a bit difficult in Morocco. It is true. It's totally true. But you can try. You can try if you're very passionate about it. There are a lot of people who are passionate about it, and they don't care about whether they're going to grow fast or not. They just love the research and they do it for the sake of loving research. You might be one of them. Go ahead. Although I advise you, if you're going to take the research part, go a bit, take some experience, and then go back. If, however, you love the industry and the business, there are very good opportunities in Morocco and abroad. Don't listen to people who tell you "ما كاينش الخدمة," there are no jobs. No, all right, don't listen to those. There are hundreds of opportunities if you are worthy, if you do your network, if you have skills, if you developed your skills, if you work on yourself, if you developed yourself, your hard and soft skills, and if you did your networking, if you did your seeking, if you did your search, there are opportunities. There are always opportunities for people who seek them and for people who deserve them. All right, let's just to
Yes.
close the bracket.
Yes.
All right,
Yes.
now for the projected future. Just like I said, there is a growing need. The projected future for biomedical sciences are simply, it's going to grow even more, even more in both research, pharmaceutical. It's really it has a lot of opportunities around the world, and it has very promising projects. To be honest, at least from my view, because I've read once that biomedical sciences are a futuristic job, especially when we started talking about personalized medicine, and people who are in the field would get what I'm talking about. Personalized medicine is now not just a dream. It's starting to become a reality. So with the fast growing pace of the domain, the future prospects of the discipline is very promising. So if you feel like it's for you, get an internship, get in training, an online training, whatever. Try to.
Thank you for the different insights, because you were like talking and you were like in the flow, and I was like listening, and I'm going to just reformulate what you were like explaining about the projected future. The part one, it's so important, because when we think about future, we think about, should we stay here in Morocco, should we go abroad, what should we do? And as you mentioned, we should seek experience so we can help our personal life by a good salary, etc., and also contribute in helping our society and impact. And as you said, it's not because in the United States website you mentioned the progress of this field is like growing fastly. It means that everywhere it will be growing fastly in Morocco, and especially in this era, like the time we are confronting, we need more biomedical scientists in our life. We need people who understand what's healthy and what's not healthy for a human being. We need that more so we can approach our education, approach our culture, and approach also our economical attitudes in how we consume, how we do things in our life. So yeah, in the upcoming year, I guess it's so important that students and entry level professionals who are like seeking to work on something meaningful, I guess biomedical sciences will be something meaningful for them. And finally, I guess I just want to give you more space if you have a message to share with youth in Morocco.
Uh, oof, sure. All right. My message is uh, no matter what the others say. All right. And I think, okay, you might find this cheesy and you might find it, I don't know, like many people said, on television, the movies and everything, you'd be like, no, this is just fantasy. But it's true from an experience. I'm talking about this wholeheartedly, my heart as an experience, and I'm very honest. All right. No matter what the others say, okay, whoever you are, you can get whatever you want as long as you believe in yourself, as long as you seek personal development, as long as you believe that you're going to get what you want. Because the only limitation that anybody has is in their mind. And that's a total truth. I have experimented it, all right? I have put uh, problems in my head and I have put limits in my head and I was limited. But the second I changed my mindset, the second I was like, the world is big. There are hundreds, millions of opportunities right there. Why am I limiting myself? All right. Universe has a lot of things to give, limitless. So don't limit yourself, no matter what you like, whether you like biology, geology, business, human sciences, sociology, psychology, criminology, I don't know, law, international relations, medicine, whatever, telecommunications, informatics, bioinformatics. By the way, we do study bioinformatics, which is a very, very growing domain. It combines biology and informatics, and I've studied it a lot. AI, whatever you love, whatever you like, whatever you think you've got passion to, art, design, whatever you feel that you are passionate about, you can do it. Don't listen to other people when they tell you, there aren't opportunities, especially in Morocco. There's nothing to do in Morocco. That's nonsense. All right, that's rubbish. With all my respect, that's rubbish. There are a lot of things to do. Okay, you just got to develop yourself, because in every single environment there are going to be challenges. All right, you're going to find challenges, but as long as you believe in yourself and as long as you ignore the challenges and that you focus on your growth, you're going to find amazing opportunities. And don't limit yourself and say, okay, I just got that opportunity. If it's gone, it's gone. I'm not going to be able to do that. No, it's not true. The world is rich. There are a lot of things to do. Believe in yourself, grow, develop yourself. Don't stay stuck and blame the country or blame the system for your own boundaries. Develop yourself, because self-development is key to every single success, to every single advancement. Develop yourself. Don't care about what other people are saying. Don't care about what other people are talking about, the problems of employment or of, I don't know, studying or whatever. No. If you love to try and challenge yourself even abroad, if you want to meet new people, meet new cultures, broaden your horizons, going abroad is also a very good idea. And you're going to find even more opportunities, to be honest. You're going to find even more opportunities. You're going to grow as a person and as a professional. And if you choose, if you want to contribute in the advancement of your country, I hope you would employ or the capacities you have learned over the years into your country. Have it, because I do encourage that a lot. Whether you go there for 10 years, 5 years, 2 years, 15 years, my advice, my personal one, and of course you've got the freedom to do it or not, is to contribute even with a little part in the advancement and the development of your country, because in my opinion, that's the least you can do for your country, for your home. Uh, it housed you for since your birth. It gave you a lot of things. You might think I'm lacking this and that. If I better, we don't have this and that. Focus on what you have. Don't focus on what you don't. Okay, focus on what you have. Focus on advancing yourself, developing yourself through training, online learning. There are a lot of online learning platforms that I have been using for years that have helped me develop myself. Do that. Focus on yourself and don't care. Choose whatever you love, choose whatever you like. If you don't know what you love and what you like, it's okay. Experiment, discover, go there, go here, and go there. Ask until you figure out what you love and what you want to do. And yeah, the only limitation is in your mind. Keep the world is rich, and you have limitless opportunities and limitless capacities and skills and potential. You just gotta unlock that potential and unleash it, and yeah, all of your dreams are going to come true.
Yes. Well, the only limitation is in our minds. Exactly.
Yeah.
Yeah, that's a good message. Yes, that's a good message because if I'm going to limit myself, why should I seek life? Because life,
Yeah.
because life, uh, because life based on there is no limits, based on discovering. And when we talk about discover something, it's like going to the endless of things to see what's there. So yeah.
Exactly.
So, and especially with the mindset of a student, because being a student means that we need to learn more, we need to explore more, we need to do mistakes more, we need to
Definitely.
accept ourselves more. And basically today I'm like observing students in another way. Students like thinking like they have a job, and they look for stability in the period of being a student, and it's not good, it's not okay. We should accept that we need to learn, we need to make things, the pleasures and how we want to enjoy life. It should be aligned with our capacity to accept that what we are doing right now, it's not like something joyful, it's something to learn. It's difficult,
Yeah.
but we should accept it. And yeah, and the only limitation is in your mind, my dear students, if you are like listening to us. And I want to thank you, Nuhaila, because what you did
Pleasure.
is like fantastic, and I love that. And I feel like I know a little bit of biomedical sciences. So if I'm going to meet someone in family or something like that in society, I will have something to share and make people aware about the future more.
I'm glad to have contributed in
Yeah,
that.
thank you very much. And I guess I
You're
will I
welcome.
will let you, because I already take one hour from
Yeah.
from your time. And thank you very much. I will work on the podcast, and I will edit it, fix if there is some problems, and I will share it in YouTube and send you the link.
All right. All right.
Thank you. Thank you very much.
Deal. Thank you.
Thank you.
Bye bye.
Have a nice day. Bye bye. Bye bye.